The anxiety and depression problems developed during 2.5 years with nightmarish medical conditions. Finally, it departed, but left me with anxiety, depression, and loneliness.
The target population for our senior mental health program is older adults aged 60 or older, which is a subsection of the serious mental illness, 18 and older. We serve individuals with major depressive disorder, older adults who display depressive symptoms and are going undiagnosed and underdiagnosed. We then link them to qualified mental health providers.
Depression is common among older adults. According to the National Institute of Health, studies by the Centers for Disease Control and Prevention estimate that 7 million American adults over the age of 65 experience depression each year. Approximately 68% of adults age 65 and over know little or almost nothing about depression. And 38% of adults age 65 and over believe that depression is a health problem. If suffering from depression, older adults are more likely than any other group to handle it themselves.
I am more aware of mental health resources in my community. I now know the signs and symptoms of depression, and I feel I have the information now needed to take charge of my feelings.
Lifescape's senior mental health program seeks to strengthen older adults' resilience and mental health well-being through many of life's changes by assessing, educating, and referring participants to the support and help they need.
But I know with Lifescape, I can always reach out and say, hey, I need this, or can you help me with this? Like I said, you ladies have been a lifesaver. That call, I'm so glad I answered that call that day.
Lifescape's Senior Mental Health Program, SMHP, and its adoption of the Healthy Ideas Program is the only one of its kind in Winnebago County. Only 12 other agencies in the state have adopted it, with many of those agencies condensed in the Chicago suburbs. We utilize validated screening tools to assist with recognizing social isolation, loneliness, and depression. Using an evidence-based program, Healthy Ideas, we focus on depression awareness and education to ensure participants can recognize signs and symptoms of depression and link them to community services. Depression is not a normal part of aging, and we are here to assist you with cultivating coping skills and provide education and advocacy so that you can live full, healthy, connected, and informed lives. Clients are referred to Friendly Caller Program, Home Delivered Meals, RSVP Volunteer Program, Information and Assistance, Counseling Services, Socialization Opportunities, Transportation. Since the start of the program, 6,661 older adults have been educated on depression and Lifescape's Senior Mental Health Program. 1,534 people were screened for depression. 20% of those screened qualify for the program. 21% of those who qualify enroll in the program. 83 people completed suicide risk assessments. 68 people enrolled in the program. 24 enrollees report a positive change in their perception of mental health treatment. 50% of those who consistently participate in our depression support group report a decrease in depressive symptoms.
You know, I feel so blessed. It makes me so thankful, and I feel so blessed.
Yeah.
That I'm where I'm at, even though sometimes it's a real struggle and you think you're not going to make it, but better than
But Mom, I think you cut yourself down too much. I think you've grown immensely with these people's help. I would recommend their services to anybody in your situation because it has dramatically improved the quality of your life.
Of those who completed the program, 90% report that they now know the signs and symptoms of depression. 80% report that they have the information needed to take care of their mental health. 80% are satisfied with the services they receive.
I like the program very much. It is a good program to have because some people can get sad and lonely. They need someone to talk to, and it has helped me a lot.
And the ironic thing is, years ago, I worked for Protestant Community Services, which turned into Lifescape.
Where we're going in the future. Continued Healthy Ideas groups at independent living facilities, beginning the Aging Mastery Program, collaboration with the Rockford Family Peace Center.
When people there, when I see somebody that needs help, call Lifescape.